Good morning. I am Dr. Sanjiv Gupta, interventional cardiologist working at NH Narayana Hospital, Jaipur, India. The sheet anchor of modern treatment for hypercholesterolemia is statin therapy. However, 10 to 20% of patients fail to achieve target LDL-C levels despite maximal or intensive tolerable statin therapy. Another 5 to 10% patients develop statin intolerance. PCSK9 inhibitors are potent anti-lipid drugs useful in this subset of patients. The LDL is cleared from the blood by binding to LDL receptors found on the liver cells. PCSK is an inhibitor of LDL receptors. Inhibition of PCSK9 results in upregulation of LDL receptors and decreases the LDL-C levels from the plasma. Three monocomponent antibodies are available for PCSK9 inhibition, namely Evolocumab, Alirocumab and Bococizumab. These drugs are given subcutaneously once in 2 weeks or once in a month. The US FDA in 2015 approved Evolocumab and Alirocumab for use in patients of homozygous familial hypercholesterolemia (HoFH), heterozygous familial hypercholesterolemia (HeFH), and mixed dyslipidemia with atherosclerotic cardiovascular disease. PCSK9 inhibitors cause significant reduction of LDL-C by 50 to 60%. In addition, there is reduction of lipoprotein A and other lipid fractions. Meta-analysis of PCSK9 inhibitors by Lipinski and Neversey et al. Have shown significant reduction of all-cause mortality. Two newer studies, namely the OSLER 1 and 2 and ODYSSEY trial, have shown approximately 50% reduction of adverse cardiovascular endpoints like unstable angina and myocardial infarction. In USA, a treatment cost of PCSK9 inhibitor is between $14,000 to $15,000 per year. The ICER has therefore advocated that at this current price, PCSK9 inhibitors are not cost effective. They have advocated that stringent guidelines be implemented for selection of patients needing PCSK9 inhibition, and government and insurance agencies should come in agreement with pharmaceutical companies to make this drug more cheaper. The NHS UK has come in agreement with Amgen to provide Evolocumab at discounted prices. The National Institute of Health and Care Excellence (NICE) has said that Evolocumab is cost effective. The current indications for use of Evolocumab in NHS is in patients of HeFH with ASCVD when LDL-C is greater than 135 mg per deciliter, HeFH without ASCVD when LDL-C levels are more than 155 mg per deciliter, and patients of mixed dyslipidemia when LDL-C is more than 195 mg per deciliter. To conclude, PCSK9 inhibitors are potent anti-lipid drugs useful in patients where statin alone is not able to achieve requisite LDL-C targets. However, these drugs need to be given subcutaneously and are expensive. Hence, the ultimate goal would be to obtain an oral pill which would be cost effective and needs to be administered only once in a month. Thank you.